The other thing that's a problem, still not completely fixed, but fixed in many areas of the country, but not all, is the delay between the time you do the test and you get the result back. If it's 5 to 7 days, it almost obviates the purpose of contact tracing, because that means somebody was out there for 5 to 7 days, potentially spreading the infection.
That's Dr. Anthony Fauci during a medical town hall yesterday. And with us now, former FDA Commissioner Dr. Scott Gottlieb. Doctor, would you care to respond to that? I hear that complaint from so many people telling me I took a test, I didn't get it back from the health department for 10 days. What good does that do me?
Well, Tony's exactly right. When this becomes epidemic in some parts of the country, the lab-based testing system becomes overwhelmed. So companies like LabCorp and Quest simply become overwhelmed with the number of tests that get sent in. And they're really the swing capacity in this country. They're the big platforms that have the ability to swing capacity into parts of the country where the virus is becoming epidemic. But part of the challenge also is that we're far too dependent on labs to do testing. If you look at other countries, they have more point-of-care tests and they have more what we call lateral flow tests, things like pieces of paper that can give you a readout on whether you have COVID at the point of care. Even for home use, although I think we're a long way from clearing tests for home use, something like a pregnancy test where it's a sheet of paper, you take a swab from a patient, you put it on the test, you drop some fluid on it, you wait 10 minutes and you get a result. A lot of countries have those technologies. I think you're going to see them start to come into the market very quickly here in the U.S., and I think that's really going to open up new opportunities for testing, to use testing not just to diagnose active infection in people who have symptoms, but use it much more aggressively as a surveillance tool in large populations to try to detect outbreaks before they become large.
So, Doctor, here's some numbers from yesterday. COVID-19 deaths from yesterday. Spain, 24, France, 17, Japan, 16, Canada, 13, the UK, 12, Germany, 9, the United States, 1,358. Population of the countries above 426 million. Population of the United States, 328 million. So we failed, obviously, as a country over the past 6 months on several levels to keep those numbers down. What do we do over the next 6 months to avoid a repeat of this, especially as we go through the period that you say could be the most dangerous, that period where a flu epidemic collides with the COVID pandemic?
Yeah, I think it's going to be a very difficult fall and winter. Now, there's some indication that flu may not be as severe this winter. You're not seeing a lot of flu in the southern hemisphere at all. And so some of the steps we're taking to try to prevent COVID spread is having even more of an impact on flu spread. So that's some of the good news. But the reality is, as we get into the fall and the winter season, people move inside, classes do restart, other respiratory pathogens circulate that are going to confound a diagnosis of COVID. It's going to be harder to prevent outbreaks. And so I think what you're likely to see is sort of migratory outbreaks around the country. We've kind of solved the epidemic in the Northeast. The Sun Belt looks like it's resolving. Now you see spread moving into parts of the Midwest and the West. And if this infection does move into more rural parts of the country and becomes pervasive there, that could be even more difficult than when it moved into dense cities where you were able to target resources into those cities and get alliance around sort of measures to control spread, social distancing, policy measures. If it's over a very geographically dispersed, diverse region, that may be more difficult to control. And that seems to be what's taking shape in the Midwest and the West. Unfortunately, we're going to have more infection before we get through this. And if you look at just the rate of infection we're on right now, if it doesn't get a lot worse, but doesn't get a lot better, by the end of the year, we're going to have 30% of the population probably infected with this. And unfortunately, there's going to be a lot of death and disease along the way. We're not out of this by a long shot.
Dr. Gottlieb, I want to ask you about colleges. Notre Dame announcing yesterday that it was going back to online classes after just 8 days in their first attempt to send everybody back into school. North Carolina, University of North Carolina in Chapel Hill, a similar story. Michigan State announced yesterday it will have online classes. Was this inevitable in some ways when you're asking 18 to 21-year-olds to go to college but to not get together, to not socialize, to not have parties, and to not mix in the dorms? Is this just too much to ask of colleges to do this in a safe way?
I'm not sure it is. I mean, it's very difficult when you have this much infection around the country and you're bringing together college students who are living in close proximity and where there's a setup for spread. But when you talk to a lot of the university presidents, I've talked to a number of them, they were putting in place pretty aggressive measures, very routine testing. Some colleges were going to test the entire population as they returned and then test them 3 times a week and use testing as a tool to try to detect outbreaks, keep the students somewhat separated, try to protect the faculty. So they were doing all the things they should be doing. Where it seems to have broken down is on the social activities off campus. And I think these colleges need to have a zero tolerance policy that if you want to come back and have a fall semester, you might have to give up partying, large parties for the semester. It mirrors a lot of the things we're seeing with the mask debate. People want the economy to restart, but a lot of people don't want to take simple interventions like wearing masks that could help us have a more robust restart of the economy and help us get back to normal activity. Same thing with colleges. You can probably come back safely on campus if you implement all those measures. You protect the faculty who are more vulnerable and the staff, but you're not going to be able to have social gatherings like you had last year. First semester, you're going to have to give it up, and students were unwilling to do that in some parts.
Dr. Gottlieb, I want to hear more about your piece in the Wall Street Journal entitled "Lifting Lockdowns Won't Fully Restore the Economy." And I'll tag on to that. What about quick tests? Why don't we have them? Do other countries have them? I know the White House has them. Wouldn't quick tests, like very universally used, widely used, help restore the economy?
I think it would. I think we need to think of screening as something, testing as something we can do to do routine surveillance in a population to try to detect outbreaks and do the case-based interventions that we talked about, the tracking and the tracing. What we need is a very inexpensive test that can be easily deployed in something like a school, in a nurse's station, where you could test the student population on a regular basis. The test needs to be literally dollars. I think we're going to have that technology. It's the lateral flow technology I talked about, the pieces of paper that look like a pregnancy test where you put the sample on the paper. Right now, the quick tests that we rely on are mostly antigen-based tests like the Abbott ID Now, which is what the White House is using, or the Sophia 2, or BD's Veritor system, where it still requires a machine. It's CLIA waived, meaning it can be run in a doctor's office, but it still requires a machine, and it's still somewhat complex to use. What we need are those very simple point-of-care tests that really anyone can be trained to use that are so cheap they're literally, $2, $3, $4 a test. If we get that technology, and I think we're going to have that probably this month, I think you're going to start to see these kinds of products come onto the market. They've been worked on for months now, and they're under review at FDA. If they do come onto the market in volume, I think it could really change how we use testing as a way to control the epidemic.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.